Vani Season 2, The Voice of IIPH. In our previous episode, we explored the foundational concepts of public health, and today we're going to dive deeper into the multifaceted world of hospital administration. I'm Shaili Sen, your host for today, and we have a special guest joining us, Dr. Medha Wadhwa. She is a distinguished faculty member and also specialized in the field of hospital administration. Dr. Medha is a dedicated healthcare management expert and assistant professor at the Indian Institute of Public Health, Gandhinagar, where she leads the Center for Quality Improvement and Patient Safety. With a PhD in healthcare management and an MBA in healthcare, Dr. Wadhwa brings over a decade of experience in hospital administration, quality improvement, and technology assessment. An SQF Fellow in the Patient Safety and a certified NABH internal auditor, she actively contributes to the healthcare sector through capacity building trainings for hospital administrators, consultancy projects for quality improvement initiatives, and various research projects. We are absolutely delighted to have you here, ma'am.
Thank you, Shaili, for the introduction.
Now, let's begin with the fundamentals. Ma'am, what do you think is actually hospital administration? Also, why do you think has this field emerged in the recent years? And how can aspirants who are aspiring to pursue a career in this field can pursue it?
So, hospital administration is a field which actually leads to development of hospital administrators which work in the area of hospital, clinics, nursing homes and different healthcare agencies. These administrators work for operational efficiency, delivering quality of care, patient-centered care, and ensuring that there is regulatory compliance when the care is being given to the patients. Coming to your second question, which was about that why this field is emerging in the past previous years, I think it is majorly after COVID-19 pandemic, where it came across that there is a need to have skilled management professionals who are needed to operate these hospitals, clinics, nursing homes, deliver patient-centered care, and apart from that, these recent years have also seen an emerging trend in technological advancements. There is a growing awareness towards regulatory compliance. There is also a growing focus on patient safety, quality of care, and that is why this field has actually emerged over recent years.
Also, ma'am, how do you think can professionals pursue this field?
Okay, for professionals to pursue this field, there could be two ways. One, you could be a graduate in any discipline and you can have Masters in Hospital Administration or MBA in Healthcare and Hospital Management or a PG Diploma in Healthcare and Hospital Administration. Apart from that, even there is bachelor's option available in Hospital Administration, Hospital Management, Healthcare Management, which also can create a specialized pathway right from your graduation. So followed by post-graduation and then a PhD in this field.
Okay, great. Thank you so much for your insights, ma'am. Now, many of the students who aspire to pursue this career might face this confusion that what is the basic difference between a master's in hospital administration and an MBA in healthcare management or hospital management. So could you please clarify this for our students?
So that's a very relevant and actually an appropriate question. A lot of times this is the query of a lot of students. This is a confusion also. So Masters in Hospital Administration is a specialized course for hospital administrators focusing on hospital operations, focusing on quality improvement in hospital, focusing on regulatory compliances in hospital and healthcare organizations, while MBA in Hospital and Healthcare Management is having a foundation in healthcare sector but will also have core business operations like finance, marketing and human resource. So anyone who is planning to pursue hospital administration, depending upon their goal and objective, they can distinguish between whether to follow MHA or MBA in healthcare management.
Okay, thank you, ma'am. I'm really sure that our listeners and our students, it would have been very clear for all of us that what is actually MHA and what is the difference between MHA and MBA. So moving forward, ma'am, could you please enlist few of the challenges which are faced by today's hospital administrators? Also, could you specify that what are the advantages and rewards of pursuing a career in this field?
Okay. I'll answer your first question, which is on challenges, and I won't call it actually challenges. I'll call it more as an opportunity, which is also challenging at the same time. So one of the most common challenge is which is everywhere: budget constraint, lack of human resource. So that is the biggest challenge as well, here as well in hospital industry. But having said that, there are different challenges in terms of technological advancements which are growing. There is a growing awareness among the population as well towards the quality of care. So today the administrators need to be very wary of that what kind of care is being provided at the hospital. The healthcare professionals need to be very skilled. They need to be very upbeat about what kind of new advancements are coming up. Robotics, automation. These are some of the emerging opportunities, acting as a challenge as well to adopt it. So that is where it comes as a dual sword kind of a thing. That yes, it serves as a challenge for them. If they are able to overcome that, it becomes an opportunity as well. Apart from that, I would say again a growing focus towards regulatory compliances, because more you move towards quality of care, there is a need to adhere to the law of the land, where regulatory compliances need to be adhered to. So ensuring that the legal framework is being followed, ensuring that the ethical practices are at stay. When we talk about health insurance, we talk about claim settlement, all these things require regulatory compliances, ethical frameworks to be at work. So that is also one of the challenge as well for the administrators, to always be on toes to ensure that they are able to overcome these challenges, making them as an opportunity for their career.
Okay, that was truly enlightening, ma'am. The insights that you have shared, they're incredibly inspiring, really. Now, I think this is the time to lighten up this conversation a little bit. Let's switch to the fun segment, which is called Rapid Fire. So, I will be telling you a word, and you will have to respond back by the first word that strikes to your mind.
Okay.
Okay, let's go. Health,
Wellness,
hospital,
care,
IIPH,
public health,
Shaili.
dynamic.
Wow, it's such a sport, ma'am. Thank you so much for your engagement. As we wrap up, what would be your parting advice for students who are aspiring to pursue their career in the field of hospital administration?
For the students who are aspiring to pursue their career, I would suggest them to understand that hospital is not just a building where they work. It is actually an ecosystem which drives quality, which talks about operations, which talks about patient care, guided by empathy and ethical framework. That needs to be understood by the students who are aspiring to be the hospital administrators. They should be eager to learn, they should be eager to update their knowledge, not keep themselves closed within the doors of the hospital. So that is one other advice that I would like to give to the aspiring hospital administrators.
Thank you so much, ma'am. We're really grateful to have you.
Thank you, Shaili. It was nice to talk to you.
So, as we conclude with this insightful discussion, we have an important announcement to make. Admissions for the year 2025-2027 are now open. So, students who are aspiring to pursue their career in the field of hospital administration, this is the right time. Do not forget to subscribe our channel. Thank you so much for all the listeners for tuning in. And also, for more engaging videos, subscribe our channel. Until then, stay healthy, stay happy.